So, but I think the fact that it's smaller, that way questions come up, we can stop and address them as we go along. A few months ago, I think Kristen contacted our boss to give this talk, and being the good boss that he is, he delegated to Carly and I. Carly has a little bit more background in biking, and over the past few summers has really ramped things up and does quite a few races. I am a runner, not a great runner, but that's my stress outlet. So we kind of divided the talk where she's going to be talking about some stuff more related to the biking injuries, and then I'll flip over to the running stuff. And then at the end, we're just trying to give you some wrap-up of things to watch out, so that as you're training, to watch out for some common overuse type things. So, having said that, in the simplest terms, training is practicing to improve. I'm sure if you guys are training for this triathlon coming up, or if you've done a 10K or a half marathon or some particular bike race, you may or may not have followed something that you found on the internet, or something that somebody gave you about this many miles this week, and then you slowly try and increase it. And so the purpose of training is to get your muscles stronger, your bones stronger, improve your aerobic capacity. And what we're trying to do today is kind of focus on the challenge, which is improving without crossing the line over into injury. So Carly will start to talk about bike-related problems.
So there was a study done in California in 1995 by Wilbur and some of his colleagues, and they were kind of looking at the prevalence of overuse injuries in recreational cyclists. And what they found, they surveyed over 500 cyclists, and what they found was 85% of them reported occurrence of overuse injuries. And so this is a list of some of the more common ones. Neck injury, neck pain kind of tops off the list, and with knees being a close second, and then you can see groin and back coming after that. So I was going to talk about a few of these more common ones. The first of which, neck and back pain. With cycling, you are in kind of a crouched or hunched over position for long periods of time, which is kind of unnatural for people. That's not usually the position that we're comfortable in. So it's important to have a really good fit with your bicycle, just for the amount of time you're spending in that position. Careful to monitor your technique and training intensity. So basically the amount of time that you spend on the bike, you can actually work up to that intensity that you want to achieve. And then another thing is muscle imbalance. A lot of times, especially athletes, might have a muscle imbalance. They overtrain certain muscles in your body, and so obviously they get a lot stronger, and you might neglect other muscles that might help stabilize the joints or the body. Comorbidities, things like arthritis, previous injuries or surgeries that you might have had in the past also play into neck and back pain in cyclists. And also, specifically with triathletes, there was an article done in 2011 by Miglerini, and he was looking specifically at triathletes and their injuries, but with back and knee pain, he was looking at the bike to run transition. And in this transition, a lot of triathletes will complain of knee pain and back pain. And his theory is that while you're spending so much time in that position on the bike, and then you go to get off the bike and start running, that puts a lot of extra load or force on the joints, especially when the neuromuscular system is trying to reorganize and get you ready for the running section of the triathlon. So in that period, it's hard for the body to absorb the forces from the ground, and a lot of it gets transferred up to the knees and the back, and can cause injury or pain that way. So next, so here's Lance. He's kind of in that aerodynamic, that crouched position that gives him the best posture for speed. So I just wanted to look at this because you can see how flexed or how bent over the back is. That creates a lot of pressure in the back. It can increase the pressure of the discs in between the vertebrae, which can lead to back pain. And then also because he's in such a flexed posture, you have to ride with your neck extended in order to be able to see the road or the field in front of you, which in itself is not the most comfortable position, which brings me to neck pain. So you're in this position for a long period of time. It's kind of a compromising position for the spine. In extension, some of the nerves that exit the neck, some of the spaces where they exit get kind of narrowed or closed off. And depending on if you have any other previous injury or arthritis, that can cause issues. And then also, so you're in that position, the muscles in the back of your neck are shortened or tightened, and that can cause fatigue, and then also lead to like trigger points or spasm of the muscle, and can cause pain that way. Those muscles in the back of your neck get tightened, and then therefore some of the stabilizing muscles in the front of your neck are a little bit stretched out and maybe weakened. And then another one having to do with neck pain in cyclists, a little less common, but thoracic outlet syndrome, cyclists can be a little bit prone to. This is where, so the nerves that are coming out from the cervical spine, and then possibly combined with some of the vessels also, can get caught in some of the cervical muscle, kind of in the area of the clavicle or the rib, and that can cause pain or numbness and tingling, starting from the neck or the shoulder and radiating into whichever arm you're having difficulties with. And cyclists can be susceptible to this just due to their positioning and some of the neural tension that they're already putting on the nerves. So that can cause pain. It's important to, if you're having persistent symptoms of numbness and tingling, it might be a good idea to have it checked out by a physician, just so you're not causing further damage. So what you can do to combat neck pain is change your position frequently on the bike, especially with road bikes with the drop handlebars. You're able to change your hand position on the bike, and that will help a little bit. You can take periods of time where you can stretch your neck. So the best way would be to kind of look down and stretch the muscles on the back of your neck. That'll help alleviate some of that. And then riding with a less rigid posture. Road bikes are meant to be rigid. They're meant to transfer the energy from your legs down to the ground, and without wasting that energy. But in the same token, a lot of the bumps and cracks that you hit that is transferred through the bike up into your hands. And so if you're riding with really stiff elbows, some of that tension can be transferred up to your neck and your shoulders. So another thing would be to have a proper fitting helmet. If your helmet's too loose or not fitting correctly, it can slide down a little bit, and then that forces you to extend your neck even farther to be able to see past it. So back injuries. And like we said, this is kind of due to that positioning also. It can lead to fatigue or pain in the muscles around the back. And then, like I said, it increases the intervertebral disc pressure, which is known to potentially cause back pain as well. And then if you tie that into the running aspect of a triathlon, that can really cause some issues. Tight hip musculature. So if the muscles in the back of your legs are tight, they can rotate the pelvis backwards and putting stress on the low back. And same thing, the muscles in the front of your hip are tight. You can have an anterior pelvic tilt, or your pelvis rolls forward, and then you have a little bit of an extra arch in your back, and can also cause stress. And this is on and off the bike. It doesn't necessarily have to be while you're on the bike. You can have that muscle imbalance regardless. And then a decreased core strength. It reduces the optimal positioning of your pelvis on the bike, and stability. You have to have a good stable core for your legs and your arms to work off of. So sometimes with a decreased core strength, you might see a cyclist kind of rocking back and forth in the saddle, and that can indicate decreased core strength sometimes. So what you can do for that, make sure your bike is fit properly. Any bike shop can help you with that, especially the reach from the handlebars to the seat. You obviously want to have a good aerodynamic positioning, but everybody has a different or appropriate posture that they're comfortable in, so make sure the reach is appropriate. You can do some testing and some stretching for tight hip muscles, just to kind of combat that muscle imbalance. And then proper conditioning. So when you think of training, you think of training like the leg muscles and get to be stronger, more powerful, but you also are training your postural muscles. So you want to increase the endurance in the saddle as well for that. And then also just adding a stretching or core strengthening routine is good, or some sort of cross training is good to work some different muscle groups. And then next one is foot and ankle. Common complaint with cyclists is hot spots on the bottom of your foot. And this is a pain and burning sensation kind of at the ball of your foot. And that is caused by, there's some nerves at the bottom of your foot, and they can be compressed at the metatarsal heads, causing that burning or nerve pain sensation. It's more common with the clipless pedals, where you clip into the pedal with your shoe, just because the pedal is a smaller pedal, so it's concentrating the force over the ball of your foot. It can also be caused if your shoes are too tight, they're compressing the ball of your foot too, and that doesn't help. High mileage, if you notice that you're increasing your mileage and maybe you're getting these hot spots. And then hill climbing, you're putting more pressure through more of the pedal stroke on climbing hills. So, and then what you can do to kind of avoid that is make sure your shoes are fitting appropriately. When you're looking at buying shoes, you can test them. The sole of the shoe should be pretty rigid. If you go to compress the shoe at the toe and the heel, it shouldn't really bend, and that'll help to disperse some of the forces throughout the bottom of your foot in the biggest surface area than just that pedal area. A lot of bike shops will sell orthotics or shoe inserts. The thing with that is you want to make sure your shoe will accommodate that as well as your foot, so that the shoe's not too tight. Also cause compression. And then if those don't work, you can move the cleats back on your shoe and lower your seat a couple millimeters, and that'll help it to redistribute the pressure on your foot also. Next one, Achilles tendonitis, and that is inflammation of the Achilles tendon at the back of the foot or the heel. And that is an overuse injury. It's due to repetitive stress on the tendon and small little micro tears. And that can be caused by tight calf muscle and your foot mechanics during the pedal stroke. And this next picture is kind of an example of that. This is a pedal stroke and showing you what not to do. So if you're paying attention to your pedal stroke, your toe should not be pointed down during the entire pedal stroke. You should go throughout that ankle range of motion while you're pedaling. So you can see the top, especially the top and the bottom, you can tell the toe is pointed down. That just shortens the calf muscle, and puts strain on the tendon. So if you run into Achilles tendonitis, some things to do immediately for it is just to ice NSAIDs and rest off the bike for a period of time until that pain goes away. You can adjust the seat. If your seat is too high, that'll kind of force you to do that down, that toes down pedal stroke. And then just monitoring your pedal stroke so that you're more aware of it and you're not doing that ankling. A saying that I've heard quite a bit is when you're down at the bottom of the pedal stroke, it's almost like you're trying to scrape mud off the bottom of your shoe, and that'll help bring your heel back and down to kind of avoid that ankling. And then just stretching for the calf musculature, the gastrosoleus, will help lengthen that muscle out. And then the next one is cyclist palsy, and that happens at the wrist. And technical term for that is ulnar neuropathy. And there's nerves that run at the base of your wrist, kind of on the pinky side. And so when you're on your bike, you want to try to avoid having your wrist in extension and putting too much pressure on that area of your hand. So that can cause numbness of the last two fingers, and then at its worst, it can cause some muscle weakness as well. So what you can do for that is try to avoid riding with your wrist extended. You can also change the position of your hands on the handlebars frequently during your riding, just to kind of change positions and get the pressure off your wrists. You've probably seen the padded gloves. You can buy gloves with padding at the wrist to kind of help absorb some of the shock. They also sell bar padding that you put underneath the bar tape to help absorb shock from the road as well. And then the other thing is just to make sure your saddle is level and you're not forcing too much weight on your hands. And then this picture, I just like this picture. It shows, it has more to do with knee pain. The middle picture is the correct way to go throughout your pedal stroke. You want the hip to be right over the knee. That way the force of the hip is transferred down through the knee and the hip. If you are pedaling with your knee too far out to the side, that'll put stress on the inside of your knee. And then if you find that your knee is falling in, that'll put more stress on the outside of your knee. So it just kind of shows how stresses are dispersed with that. So, and then I think Marcia is going to talk about some knee pain and common running injuries.
Back to me. If you remember Carly's list, she had a long list of things that go wrong with cyclists. We only have 3 to talk about. Actually, there's several more that I could have put on there, but I tried to focus on some of the main ones and just maybe really get into them a little bit in depth so that if we understand kind of the mechanics of what's going on, you might be able to help prevent an injury. One of the things that I read getting ready for this is they said that 80 to 85% of injuries with training are overuse injuries. So therefore it follows if it's a training error, it's probably preventable. So if you maybe understand your anatomy a little bit better, you might be able to sort of problem solve, oh, I might be doing too much of this or too little of that, and maybe, keep yourself from getting injured, be able to run, bike, swim, whatever it is, better. So the 3 that we're going to talk about today, iliotibial band syndrome, patellothermal pain, it's pain on the front of the knee, and shin splints, which is a little bit of a junk term. It can mean several things depending on the different medical articles that you read, but we'll talk about the different subtypes of that. Does anybody watch Survivor? Any secret guilty pleasure people there? There was an episode of Survivor not too long ago, and this guy had to be taken off the show because he had acute appendicitis. And this really cute, younger female is listening to the tribe talk about this, and a couple of people are like, gosh, I had appendicitis, and that was horrible, that was the worst thing. And this girl's eyes are getting like really big, like, what is that? And I don't want to get that. So some of these names are big, and they're like, oh my gosh, what is the iliotibial band? Everybody's got one, and it's a good thing, but we just don't want it to be inflamed or be a source of symptoms. It's the band that runs down the side of your thigh. At the top of it, on the back side, actually it starts at the ilia, the hip bone. There's some muscles at the top that insert on it. On the back, you have your glutes, the glute max, the glute medius. The front, there's a front hip muscle that inserts on it. And the band that goes down is like a real thick, fibrous tendon. And it inserts just below the knee. And also, when it goes down by the knee, there's a few fibers of it that blend with this thing called the patelloretinaculum. And that's a little thing that helps to stabilize the kneecap. And also, they did cadaver studies where they went in and kind of dissected it out to really look at it closer. And it also has bands that anchor it directly to the femur, which is important as we continue to talk about it. So here's a picture of what that looks like. Like I said, at the top, you've got muscles that their tendons are coming down and inserting on that band. The band's running down the side of the leg. And this circle area here is where you're usually going to feel your symptoms at.
Is that where's the knee on that picture?
The knee is right here. So this is just above the knee here. And then this is showing the area where it inserts. So just below the knee joint line. Here's a few of those fibers that are blending with that patelloretinaculum. So the job of the IT band, because it's run along the side of the leg, helps to stabilize the hip, it helps to stabilize the outer part of the knee. If you're starting to have problems with it, if it's hurt, where do you feel it at? You're going to feel it on the outside of the knee, just above the knee joint line. If you poke around on there, you're usually going to find one spot that's pretty tender to touch. If it goes on for a while, you can start to get soreness more down to where it inserts, or just below the knee, or you can start to get some general stuff going up along the side of the thigh. You're just getting more trigger points or sensitive points in that fascia. There's a very small percentage of people that actually have symptoms at the hip that can kind of maybe go back and forth over the greater trochanter of your hip. So sort of that side bone that you feel. Somebody's raising their hand. I have that too. And you can't hear that snapping thing. Yeah. Great feeling. Will that go away? Okay. So why does it hurt? When your knee is bent to about 20 or 30 degrees of bending, or knee flexion we call it, that's when that IT band is maximally pressed against the femoral condyle. So when it's coming down here, you got that knee slightly bent, and it's maximally pressing against there. So if you think about running or bicycling, how many times do you hit 20 or 30 degrees of knee bend? It's a lot. So it used to be thought that it was that band frictioning over the condyle, but some of the newer stuff, when they went in and looked at that cadaver study, because it's anchored to the femur, it's probably not moving so much. If you see people that are real ripped, for lack of a better word, you can kind of see that clearly defined line, and it may appear that it's moving, but it's anchored in there. Underneath of that area is a fat pad, and that fat pad has pretty good blood and nerve supply, so the more it gets compressed, that's thought to be actually what's sore. So some of the things that can contribute to it. If you have abnormal foot mechanics and too much foot pronation, does everybody know what pronation is, or have a general? When you take a step, I'm indicating with my hand here, but your foot hits the ground with your heel or the rear foot, and then it rolls flat, and that's a good thing. That disperses or helps do shock absorption. If it rolls in too much, we call that pronation, or the outer sole of your foot kind of turning outward or turning to the outside. So if your foot rolls inward too much, it's going to drag your lower leg bone along into an internal rotation position. If that turns in, that IT band is connected onto your tibia, so it's getting pulled in, so you're putting more tension force on that IT band. And then if we go up, if you have problems at the hip, a couple of those muscles that inserted onto the IT band, specifically the gluteus medius, its job is to abduct your hip, or it brings your hip out to the side. When I take a step, my pelvis should stay level if my gluteus medius is working correctly. If it's weak, my pelvis will drop, and then I'm going to have more strain along that IT band. And then just tightness in general, the muscles that are attaching onto that, they can be tight, puts more tension on that band. This next one I put in here to kind of show you the mechanics of what that weak hip abductor or the weak gluteus medius looks like. So on the left picture, their muscle is contracting pretty well here. They've taken a step on the left, their right is moving through swing phase, or it's not touching the ground, and their hips are staying level. With this one over here, it's trying to show that you have some muscle weakness. So the pelvis is now tilting down. It can't hold it steady here. So it tilts down, it puts this more kind of in tipping in position, and so that IT band that's going along the side is going to get more strain on it. So the things that, kind of from a PT's perspective, what we can do for it, we can strengthen the hip abductors. There was a good study that they took people that had IT band symptoms and those that didn't, and they put them on a 6-week strengthening program for their hip abductors. And at the end of that 6 week, 22 out of 24 people were back to running and pain-free and that sort of thing. So consistent stretching also. So, some of those tight muscles, I'm sure everybody has seen one form of another, the cross leg stretch, or have you guys seen some IT band stretches, or maybe you take a strap and you pull it across the body. We can talk about stretches towards the end too if you guys have specific questions about how it might be good ways to stretch things that you're thinking, oh, I think I might have that one. If you have a foot problem, some of those we can work with the muscles that help support the arch so that you're not going into too much foot pronation. Some people just have bad wheels and they need some extra support. They need orthotics. And then another thing is to watch your training habits. If your shoes are starting to get worn out, you might be subtly starting to overpronate and starting to maybe develop that. Hill workouts, a lot of people will incorporate hill workouts to build that strength and endurance and stuff. And if you're in that constant flex, it's a lot of tension that you're putting on it, you might be aggravating with that. And cambered roads. Does anybody know what a cambered road is? Yes. Right. It's a little bit taller in the middle, and it slopes off to the side for drainage. So if you're running on the side of it, you're going to have one leg that's sort of more shorter towards the inner part of the road, and one that's being stretched longer. And if you run miles on that, you're going to be putting a lot of strain on your outside leg. So the thought is, if you're going out and back on a run like that, that you want to come back on the same side of the road, so that when you come back, you're putting the pressure on the opposite leg. If you really have a problem, go back and forth, so that you adjust that. Then I'll let Carly jump in on this because there's also some specific bike considerations to take care of your IT band.
Yeah. So if you're having problems with your IT band on the bike, you can widen your stance, and you do this by moving the cleats on your shoe to kind of widen the stance on the bike. If you're in too far, it just kind of puts that extra stress on the IT band too, like Masha was saying. And then there's a certain amount of float to the pedal as well. Your foot is not rigid in the pedal when you're clipped in. There should be a little float, especially in the heel, that should give you a little give. So you want to make sure that you have enough of that. You can lower the seat. This would be one instance where you can lower the seat. Because like Marcia said, that area where there's 20 to 30 degrees of knee flexion is that area where you're maximally compressing the IT band against the forearm handle. And then hill gear selection, you want to make sure you're spinning up the hill. You're not just pushing or grinding your way up the hill. That puts a lot of force on the knees as well as the IT band. So something to think about.
See, I wouldn't know those things. The next one that we're going to go into is patellofemoral pain syndrome, the abbreviated PFPS. Spending quite a bit of time on this one. This is a common thing. 25% of all people walking into like a sports medicine clinic will have complaints dealing with patellofemoral type problems. The patellofemoral joint is basically your kneecap sitting on top of your femur. The underneath part of your kneecap or your patella has articular cartilage on it, and so does the notch on your femur. As your knee starts to bend, that patella kind of drops into the groove there, and that's the joint. The purpose of the patella is to help make your quadriceps function better. Did you guys ever have to memorize like the teeter-totter or the lever things, like the fulcrum, like type 1 levers, type 2 levers? By having on my thigh here, you've got your quadriceps coming down. I have this kneecap, my patella, that kind of increases the pull for the ankle. So it helps to make it more efficient when my quadriceps straighten out my knee. If my knee is fairly straight, that patella doesn't increase the angle so much, so more of the pull of the quadriceps is just like a snugging in of the joint. So basically the idea of the patella is that it makes your quadriceps more efficient to straighten your leg out. If you have patellofemoral type problems, where does it hurt? It's going to be pain on the front of the knee. You might have it on the sides of the kneecap, kind of depends on if it's getting pulled or, different tissues being involved. And it's usually a slow progression with it. It gets worse with activity though. Things like going up and down the stairs, running, squatting, prolonged sitting. Sometimes you'll hear people say, well, I went to the movies and it's like my knee was killing me when I got up because you were sitting with it bent for 2 hours. And these different things will just increase the amount of patellofemoral contact or pressure or load in the joint. Why does this one hurt? If you have excessive loading of the patellofemoral joint, it increases the joint stress and it wears down the cartilage. So it's like any other joint, you've got cartilage involved. There's certain spots when the kneecap moves that the patella doesn't have a whole lot of contact with the femur, so you have a little small area contacting the femur. When it goes through some more of its motion, you maybe have more of the undersurface of the patella contacting the femur. So normally stress is absorbed by healthy cartilage, but if you have the cartilage wearing down now, the stress is not going to be absorbed by the cartilage. It's going to get transferred to the bone underneath the cartilage, the subchondral bone. That bone has pain receptors. It's going to start to hurt. So it's probably some cartilage wear and tear that is accounting for the symptoms. There are a lot of different things that can contribute to this. Some of these things you may be born with, your bony alignment. Some of them are muscle things that we can work with. In regards to the bony alignment, the kneecap can ride up onto the outside of the joint, and I'll show you a picture here in a second. If these were the notches of the femur, the outer one, lateral one, should be a little bit higher. That helps to keep that kneecap centered. Some people they didn't get a tall enough lateral femoral ridge there, so it just has a tendency for that kneecap to sort of ride to the outside. There's also a hip condition called anteversion, and in order for the head of your femur to get into the socket, it makes it internally rotate a little bit. By internally rotating, it changes the stresses down at your knee. So those people tend to have problems. And leg length differences. If you have one leg that's a little bit longer, it's going to change the amount of patellofemoral stress that you have. This is the picture that I was sort of starting to talk about. This would be a right knee, and you're almost looking down at a straight knee. So this is your femur, and this is the notch that patella is sitting in. Medial in medical terms is the inside, and lateral is to the outside. So here's your underneath of your patella sitting in that notch, and this is balance compression. Contact and that looks good. On this one here, your right upper leg, your femur, has turned in a little bit, and now that patella sort of gets pulled to the outside. So no contact here, the tissues on the side are getting stretched, and you're putting a lot more compression or force on the outer part of that joint. And that is usually the problem that goes with a lot of the different things that we're going to keep talking about here. Besides just your bony alignment, some of these things are going to sound familiar. Excessive foot pronation. Just like with the IT band, when you walk, run, if that foot rolls in too much, it grabs the lower leg and takes that along with it, and then that transmits some funny forces up to, it's going to concentrate stress on a smaller part of the patellofemoral joint. On the flip side of that, if you are a supinator, if you don't pronate enough, then when you hit, you're staying a little bit of outer rotation for that lower leg bone, and again, it's going to be a lot more loading to the lateral part of the joint, concentrates those forces. Hip muscle weakness can be a big player in this. If your hip muscles are weak, just like with the IT band, it lets the hips kind of drop in and turn in, and so if the femur notch turns in and that patella is still being pulled to the outside, you can develop some pain. And then a lot of soft tissues or muscles can be tight with this one. Gastroileus is your calf muscles. If those are tight, I have to work a lot harder to clear my toes. And if I'm having to work a lot harder, if I don't have that amount of motion, I may pronate. It's going to travel stress up to the patellofemoral joint. If I have tight hamstrings, I have to generate, the hamstrings are on the back of your thigh, I have to generate more force with my quadriceps to overcome the tight hamstrings, so it's keeping maybe a little bit more compression on that. The IT band, the quads, the hip rotators, the same thing. Tightness of any of these things would lead to some compensation patterns that would load the patellofemoral joint too much. This is taken from one of the studies that I read, and I just liked it because I thought it put things together pretty well. Here we have the hip weakness, that pelvis is dropping, so that pulls that femur into an abduction or an internally rotated position, so it could potentially increase the load here. It also just makes the knee go into what we call a valgus position, which is a motor or putting some increased stresses on the tibial femoral joint, but it loads the outer part of the patellofemoral joint. If my foot pronates or turns in, it helps to pull that tibia along, and so the patellofemoral joint may take a beating. The things that we can do to help it, yes, we can help it. It's not all gloom and doom. Quad strengthening. By strengthening the quads, what you might be doing is changing the contact location and kind of relieving pressure over a sensitive area. With the knee, we have to be careful about how we do it. There's a thing called open chain exercises and closed chain exercises. And what we mean with that open chain, your foot's not touching the floor. So you might go to the gym, you've got that bar across your ankle, and you're doing the quad extension. Closed chain stuff, your feet are in contact with the floor. It's more of your squats or that leg press. You guys know what a leg press is. So when my knee is bent about 30 degrees, there's 2 square centimeters of the back of the kneecap, the patella, touching the femur. At 90 degrees, there's 6 square centimeters. So I have a lot bigger area touching to distribute that load across. And then the muscle contraction part of this equation is that if I have my foot not contacting, I have to generate a lot more quadriceps force during the last part to get the knee fully extended, and that could increase the patellofemoral stress. In standing, initially it doesn't take a lot of quad force to do that, but if I go into a squat position, if any of you ever had to like pull walls, squats or whatever, you're like, oh my gosh, my quads are killing me. That's the kind of thing. The lower down you go, the more quad muscle strength it takes or force that you're generating. So we have to be careful about how we strengthen. If you're the same, you guys can look at it, it's self-explanatory. But if you're doing an open chain exercise where your foot's not touching the floor, you want to limit how much range that you're going through. Start at 90 degrees, you can maybe take it up to 30 degrees, but don't push through that last 30 degrees if you're already having anterior front of the knee pain. On the flip side of that, if you're doing a closed chain exercise, start with midi squats. Go from about 0 degrees to 50 degrees because you're not taking as much muscle force for that. If you get below 90 degrees of the squat, that's usually bad because 90 degrees is kind of maximum contact, and then after that it starts to narrow down. And so if you do the exercises correctly, you can strengthen and get better without aggravating the patellofemoral joint. You also want to work on strengthening for the hip if that is where your problem area is, stretching out the things that were too tight so that they're not contributing to it. We can do things like patellar taping, or there's some braces that they made. These aren't meant to be a forever thing. It's like you are using them while going through trying to get the quadriceps stronger, that sort of thing. So it's like you're kind of taking stress off the joint while you're doing the rehab to get it better. And then again, if you just have bad foot alignment, you may need some orthotics to help correct for it. Shin splints. Like I said, it's a little bit of a junk term, but to runners, it generally means tenderness over the outside front of the lower leg, anterior shin splints, or you can have a thing called posterior shin splints, and it hurts on the front of your leg, but more towards the inside. Why does it hurt? It's micro tears in the muscle origin or the fibers themselves, and or it could be like where the muscle inserts on the bone that it's kind of pulling on that. You might get some periosteum pain. Here is just a real quick picture. Some of the muscles on the back of the calf, your soleus, some of the ones that control your toe, and this one, you're looking directly at the back of a calf here, your tibialis posterior, helps support the arch of your foot. Those are the ones that are involved if you're starting to get pain on the lower front inside part of your shin. The anterior shin splints, you're going to feel a little bit more on the outer part. It's usually the tibialis anterior involved. There's a couple other things that can be pain in the lower leg. One of them is called exertional compartment syndrome, and another one would be a stress fracture. The exertional compartment syndrome, you probably are thinking more along the lines with the shin splints. When you exercise, you have more blood going to the muscles. They kind of get bigger because of that. And the leg, there's some very specific fascia borders for the compartments. So there's not a lot of room sometimes for that extra swelling that happens, and there's a nerve running through that compartment. So you've got bone and fascia that are your borders, and if the pressure in there gets too high, you can start to get pins and needles because of nerve irritation. So if you have pain and it lingers for a while and you've got that pins and needles stuff going on, that might be something that you have to go in and see the doctor about. There's a specific way that they kind of look at that, so you don't want to mess around with that. And then the other one would be stress fractures. And I put this in there so that maybe you can kind of do a little bit of self-diagnosis to see. If you're having pain along the shin and you press around and you're sore in like one specific spot and it kind of goes across horizontally, that might be more of a stress fracture problem. If it's kind of a line going up and down, vertical soreness, it's more generalized, that's probably more shin splints. If you have a stress fracture, in the morning you're probably going to feel better. That bone rested overnight, it won't hurt when you first get up in the morning. If you have shin splints, when you get up out of bed in the morning, that soft tissue stuff tightened overnight, there was inflammation, your first steps are like, this hurts. And then as you start to get moving, blood flows better, it flushes out that inflammation, and it gets a little bit better. Like I said, the compression syndrome, if you have it lingering after exercise and you really got pins and needles and stuff, numbness, that's more nerve type stuff, and you might need to go get that checked. Both the compartment syndrome and stress fractures, you're going to have to stop running for a while. So, contributing factor for the anterior shin splints, it's usually a muscle imbalance problem. Maybe you weren't strong enough with your front of the shin muscles, and your back of the ones are tight, strong, and it's making the front ones work really hard to pull your foot up and clear it when you have your heel strike and your toe off. Downhill running can really aggravate that problem. Posterior shin splints, any leg problem that's going to lead to overpronation will probably aggravate the posterior shin splints. Those muscles are working like a brake to kind of help control and support the arch. And so they're just having a lot of pull and stress on their origin point. And then also with the posterior ones, supinators, again, you don't get enough pronation to kind of have that shock absorption or spread the forces out, and so you're kind of loading and it's getting a real focal point or sharp impact loading. Things that you can do for it, you got to make sure you know what it is, but otherwise, if it's the shin splint thing, relative rest, ice, you can take some anti-inflammatories. You want to correct the things that you can. So if you're weak on certain things, you try and strengthen for them. If you're tight on certain muscle groups, you need to stretch for it. Making sure that you fit your shoe to your foot. You guys were lucky enough to come to the talk by the guy that owned Peak Performance who went through running shoe types. Some people need a control shoe so that if you are a pronator, it's going to help support that. Some people have high arches, they need a little bit of extra cushioning, so trying to match that. You can do some taping for this. It's kind of this circular thing. Talk to your athletic trainer friends, or it can help for a little bit, but you probably need to address what the problem is. And then the training conditions. If you can, avoid running on concrete. If this is something that's available to you. You don't want to get on real loose stuff, because if you're a pronator and that's part of the problem, now you're going to be even more overworking that stuff. So they said packed dirt is best, kind of avoiding hills. And the 10% rule is something that for running, you do not want to take your running mileage up by more than 10% a week. So if you're following one of those training programs and say over the whole course of the week you ran 10 miles, then the next week you can go up to 11 miles, but you shouldn't try and jump up to 13. Most of the lower leg problems are too much, too fast, too soon. And I think those are some of my favorite quotes that I found when I was searching for this. I think, let's see here. I didn't train all that time just to come here and get it over with as fast as I can. Points out that it's showing up, it's participating, it's not if you won the darn thing. And then that kind of drops into it. I think it's a really good motto to have, that in running it doesn't matter if you come first, in the middle of the pack, or last. You can say, I have finished, and there's a lot of satisfaction in that. So I'll let Carly wrap up. Thank you.
We're kind of, our talk was more about overtraining and overuse injuries, and so just kind of wrap up some stuff. Everybody has their own threshold and what kind of training they is specific for them. So the thing would be not to compare yourself to others. Don't see or hear what other people are doing and try to think that you need to be doing more. Everybody's different, and like Marsha was saying, there's that 10% rule. You kind of have to ramp things up slowly, otherwise that's when people get in trouble with injuries. You also have to allow for rest and nutrition following workouts, just to allow your body to recover and to rebuild. Strength training, training in general, the thing is it causes these little micro tears and stress in the muscle, and so you have to allow for enough rest and then proper nutrition, protein and stuff for the body to recover, and that recovery period is when you actually get stronger. So adding cross-training activities, avoid muscle imbalance and overuse. The stretching, the core strengthening activities are really going to help to avoid injury as well. Tips to avoid overuse. We kind of talked about the terrible twos. Too much, too soon, too fast is when we'll see most of the injuries. So just be aware, listen to your body. The pain is there for a reason, and of course training is not going to be just a walk in the park. It's going to be tough, it's going to hurt a little bit, but avoid working through persistent pain and kind of know your body and listen to it. There's also something called DOMS, delayed onset muscle soreness, which you guys may or may not have experienced before. It has to do with training and strength training type things, and with those micro tears in the muscle. That is when you might have a really good, strong workout and you're feeling good, but then maybe a day or two later you get some pretty significant soreness, and that usually occurs with really ramping up your intensity with your training, and has to do with like the inflammation and the body kind of recovering from that. You guys might have seen some of the compression stockings that some of the athletes are going toward now to try to prevent some of that pain. But just knowing what it is and knowing that if it doesn't go, I think the rule is if it doesn't go away in about 7 days, it might be something to take a look at. And then if you do suffer from an injury, just know that you'll need to adjust your training routine. You can't just jump back into where you were before injury. You'll have to ramp it up slowly as far as time and intensity of your workouts. So that is all. That's kind of all we had. So if anybody has any questions or any specific injuries that they've had, maybe?
Question. For those that don't have a bike, that you can like lay down on the handlebars.
Yeah.
Repositioning to keep your wrist being extended for hours at a time. Is there any other tips you might have?
For your wrist to be extended?
Yeah, or because my fingers do go loose.
Yeah. There are the gloves and the tape that we talked about. Just because when you're bent forward like that, you're putting a lot of weight on your hands, and so if you are doing that, try to keep your wrist as straight as you can.
Okay.
The extension puts a lot of compression on the bottom of your wrist where those nerves start coming through, and that'll cause that person to take on sensation.
Doing little things too, like
Yeah.
doing handshakes periodically will really help to kind of take it out of that position. It's circulation and stuff for that nerve, so hopefully use that a little bit too. So, kind of periodically doing that or doing some hand pulls and stuff so you get movement there. So that may help a little bit too.
Do you recommend knee braces or not? I mean, I have a lot of knee pain and hip pain.
Some of this stuff
Hey,
is
when
hitting
you were
home.
well, that sounded very, very familiar. I bought one that has like this band that goes under your knee and a band that goes over your knee. I haven't tried it out yet, but is it something that would help with that?
I guess it would depend, like, where is your pain at? Or
Under my kneecap, and on top of my kneecap, but my hip, my left hip is, my left knee is worse than my right knee. So I keep thinking there's a problem with my left side.
you might need to go see us. But
I've been thinking that as well.
Just in general, I would say you probably need to look at hip strengthening stuff, doing some adductor strengthening things. I hate to give somebody advice without really knowing exactly what it is, but a lot of times weak hips tend to put too much knee stress on. So I would look at trying to maybe increase hip strengthening stuff that you're doing. A lot of the knee braces can be good if they're taking pressure off of the right thing, but if we don't ultimately correct for what is the thing leading to you having those symptoms, then it's just a Band-Aid and it's not really, fixing what the problem is. So, yeah.
I found for me with my IT band, it was from repetition. If I just go and run like 12 miles on concrete or like a Wabash, it bothers me. So now I switched to just trail running and it's gone. But if I go run like again,
Concrete roads.
it's back. So I found that it's like, I think it's just good at moving, not just constantly.
Yeah, I think that, everybody sort of has a threshold where it's like fine and you cross over that and then you start to get your symptoms. And it's recognizing like, this is about the limit of what I can do. Again, if you don't do anything specific for strengthening for your hips, you might look at that.
I have some stretches that I do for IT and it seems like it's going away. Not that I just get my plantar fasciitis to go away, I'm good.
Yeah, that's a bad
18 months now.
But women, they did a study looking at risk factors for patellofemoral problem. I mean, they looked at like a bajillion studies because I don't know how much familiarity some of you may have with this, but basically, I mean, thousands of people, throughout 130 some studies, and with all, the take-home points that you can take from that is weak quadriceps can contribute to the patellofemoral problem, and being a female is an increased risk factor for it. So as we cannot control for being female, we would need to try to work on our quad strength. So, and then we had kind of brought along a couple of these things. I really think that doing some self-massage stuff can help after a long workout. This little thing, has anybody ever seen one of these? It's like a roller bar, and it feels so good. I'll let you pass it around. But my husband ran, this crazy thing out in Colorado where you run up Pikes Peak, and he was like, So right after that, I did some leg massage, and he was like, oh my God, like I feel a lot better because he was laying in the motel. Which, I would die too. I wouldn't have attempted it. But I think, that's something that I buy at Peak Performance, and I'm not getting paid by them. But shoes that'd be great. I think they say like 15 to 20 rolls on muscle, different angles and stuff. But it feels like great on your back. I just think that it helps to flush things out. And it's good. And then this little doohickey is really great for plantar fasciitis type of things. It's really firm, hard. That plantar fascia, again, is thick, just like the IT band is a real thick fascia. So deep, firm pressure on that. Cold, frozen ice water bottle is good for plantar fasciitis problems. You can do some self-massage with that. Before you even get up out of bed in the morning, you want to try and do some stuff because, like I said, that soft tissue tightening overnight is like,
Calves too, is it your calves?
yeah, because if the calves are tight, they're maybe pointing it down, or you're in more more plantar flexions, so, and doing some toe stretches too, getting those big toes pulled up and back.
Because I noticed if I slept, I sleep, if I told you, it's on more food.
And that's a thing that they will
It's very
recommend.
sexy.
Night splits. Yeah, there's a thing that they make called night splits to hold your foot in that position so that you're kind of keeping some stretch on that instead of letting it get short and tight while you sleep. And then this one, you can lay down on, which I won't do, but this is good. You can like self-roll for the IT band tightness problems. So, and then when you guys come in, we had our fat handout, sorry, it was mostly my fault. And then there was also this one single page thing. And I just think that that was a nice reference. I wish I was smart enough to write that thing, but it was a good way of staging stage 1 injuries up to like stage 3, 4, where you might start to need some help. And then on the back of it, I think it had like the price thing, which is protection, rest, tight compression, and elevation, which is basic first aid for a lot of injuries. So that's it.
Thank you so much. Just a quick question. I've heard different things about stretching, like stretching before a run versus stretching after.
Yeah, there's some new research out there about stretching. And I think what they're saying is before an event or before a run or something, it's better just to do like an active warm-up. So just some walking or some like jogging or something like that, rather than stretching. Because that stretching will kind of take some elasticity out of the muscle and that
Okay, that's what I've been doing, and then I wait till afterwards to
Yeah.
stretch. Okay.
Yeah, I think that's definitely the way.
Or I do I have weak quads, and so then I'll go do the quad machine like after I run. Just so I'm not. I was doing it before, and that was not working very
Yeah,
well.
I mean, you probably have maybe fatigued it somewhat,
Right.
and now you're asking it to do even more work.
Yeah.
So, yeah, but yeah, I think the dynamic kind of warm up is better than, the static stretches is what we're finding. So,
Although they're good after that, after
Yeah.
running.
yes,
That's what I've been doing. Yeah.
We do have a giveaway today. The Nebraska Medical Center Wellness Program donated a 20-minute chair massage. So anybody's birthday